Hello everyone, and welcome back to my channel. Thank you for being here today. It's a pleasure to discuss a topic that is significant in the field of virology and public health, the Nipah virus. Nipah virus is a zoonotic virus, meaning it can be transmitted from animals to humans. It was first identified during an outbreak in Malaysia in 1999, associated largely with pig farming practices. The natural reservoir for the Nipah virus is fruit bats, particularly the Nipah species, which are known to carry the virus without showing symptoms. These bats inhabit forests and have a wide range in tropical regions, where they feed primarily on fruits. In terms of its structure, Nipah virus is classified as a member of the Paramyxoviridae family and exhibits a helical shape. This helical structure consists of a single-stranded RNA genome encased in a lipid envelope with surface glycoproteins that play a crucial role in its ability to infect host cells. The intriguing characteristics of Nipah virus, including its transmission pathways and the stark symptoms it can cause in humans, highlight the importance of understanding its biology and ecology. Today, we will delve deeper into the nuances of Nipah virus, its impact, and measures for containment. Let's get started. Nipah virus, NIV, is a zoonotic virus that can be transmitted to humans from animals, contaminated food, or other infected individuals. It was first identified during an outbreak in Malaysia and Singapore in 1998 to 1999, which was linked to contact with infected pigs. Since then, it has caused recurrent outbreaks, primarily in South and Southeast Asia. Key facts about Nipah virus. 1. Transmission. Animal to human, primarily through contact with infected bats. Fruit bats are the natural reservoir, or pigs. Human to human, can occur through close contact with bodily fluids of infected individuals. Foodborne, often associated with consuming raw date palm sap contaminated by bat saliva or urine. 2. Symptoms. Early signs include fever, headache, and respiratory symptoms. Severe cases progress to encephalitis, brain inflammation, causing seizures, confusion, or coma. Case fatality rates range from 40% to 100%, depending on the outbreak and medical care availability. 3. Outbreaks. Regularly reported in Bangladesh and India, often linked to the harvesting season of date palm sap. A notable challenge is the lack of a vaccine or specific antiviral treatment, making prevention critical. 4. Prevention. Avoiding contact with bats or pigs in endemic areas. Not consuming raw or unprotected date palm sap. Implementing proper infection control measures in healthcare settings. Nipah virus is categorized as a high-priority pathogen due to its potential to cause severe disease and its epidemic potential. Research continues into diagnostics, treatments, and vaccines to combat this dangerous virus. Recognizing Nipah virus, NIV, infection early is critical for effective management. But its symptoms can initially resemble other common illnesses, making diagnosis challenging. Here's a detailed overview of the symptoms. Symptoms of Nipah virus infection. NIV infection manifests in 2 phases. 1. Early, incubation period. The incubation period is typically 4 to 14 days, but it can extend to up to 45 days in rare cases. Initial symptoms are nonspecific and flu-like, including fever, headache, sore throat, muscle pain, vomiting, fatigue. 2. Severe phase. As the infection progresses, it can cause severe complications such as acute respiratory distress syndrome, ARDS, difficulty breathing due to lung inflammation, encephalitis, brain inflammation, confusion, drowsiness, disorientation, seizures, coma within 24 to 48 hours in severe cases. 3. Long-term effects. Survivors may experience residual neurological symptoms like persistent seizures or personality changes. When to suspect Nipah virus. Recent contact with animals, especially bats or pigs, or individuals in areas with known outbreaks. Consumption of raw date palm sap in endemic regions. Sudden onset of severe respiratory or neurological symptoms in a cluster of people. Diagnosis. Laboratory tests such as RT-PCR, antibody detection, ELISA, and virus isolation can confirm Nipah virus infection. Early diagnosis is critical to isolate patients and prevent human-to-human transmission. What to do? Seek immediate medical attention if you or someone you know develops the above symptoms, especially in an endemic area. Working in farms with pigs or in areas with high bat activity. Consuming unprocessed or uncovered foods and drinks, particularly in regions known for outbreaks. Lack of protective measures while handling animals or their waste. Prevention. Avoid consuming raw or unprotected date palm sap. Do not eat fruits that may have been contaminated by bats. Maintain hygiene and safety in animal farms, particularly those involving pigs. Minimize exposure to bats, especially in endemic areas. Understanding and managing these transmission routes is crucial to preventing outbreaks. If you'd like to know more about human-to-human transmission or outbreak management, feel free to ask. Nipah virus, NIV, outbreaks in human populations are relatively rare but have been highly lethal and geographically specific. Since the virus was first identified in 1998, there have been sporadic outbreaks, primarily in South and Southeast Asia. Frequency of Nipah virus outbreaks. 1. Malaysia and Singapore, 1998 to 1999. The first documented outbreak, involving pig farms, led to over 265 human cases with a case fatality rate of 40%. This outbreak ended after large-scale culling of pigs. 2. Bangladesh and India, 2001-present. Bangladesh has experienced nearly annual outbreaks since 2001, with fatality rates often exceeding 70%. India has reported smaller, sporadic outbreaks, such as those in Kerala, 2018, 2019, and 2021. 3. Other regions. The virus has not been widely reported outside South and Southeast Asia. Inform healthcare providers of potential exposure to bats, pigs, or sick individuals to guide early testing and care. The disease's high fatality rate and potential for outbreaks make awareness and prompt action essential. Let me know if you'd like more information on prevention or management. Nipah virus, NIV, is a zoonotic virus, meaning it is transmitted from animals to humans. Its primary natural reservoir is fruit bats, also known as flying foxes, of the genus Pteropus. Transmission to humans can occur through several pathways. Animal-to-human transmission. 1. Direct contact with infected animals. Fruit bats, humans may come into contact with saliva, urine, or feces of infected bats. For example, eating fruits partially eaten by bats. Being near bat colonies where the virus is shed into the environment. Pigs, during the first documented outbreak in Malaysia, 1998 to 1999, the virus spread from bats to pigs via bat-contaminated fruits in pig farms. Humans were infected through handling sick pigs, exposure to pig secretions or tissues during slaughter. 2. Consumption of contaminated food. Raw date palm sap. In regions like Bangladesh and India, outbreaks have been linked to consuming raw sap contaminated by bat saliva or urine. Bats often feed on sap collected in open containers. Environmental exposure. People in rural areas near bat habitats may inadvertently come into contact with the virus through contaminated surfaces or water sources. Key risk factors. However, its natural reservoir, fruit bats, is present in many parts of the world, suggesting potential risk areas. Characteristics of outbreaks. Outbreak size. Most outbreaks are small, involving a few dozen cases. However, they are highly lethal, with case fatality rates ranging from 40% to 100%. Clusters. Human-to-human transmission has led to clustered outbreaks in healthcare or family settings. Geographical scope. Outbreaks have remained localized, likely due to the limited transmission routes and the virus's short incubation period. Why are outbreaks rare? Nipah virus transmission requires specific conditions, such as close contact with infected animals, contaminated food, or bodily fluids of infected individuals. Effective public health responses, especially in countries with known outbreaks, have helped contain the spread. While Nipah virus outbreaks are infrequent, their high mortality rate and the lack of vaccines or specific treatments make them a significant public health concern. Ongoing surveillance and research aim to prevent future outbreaks and improve preparedness. Controlling and preventing Nipah virus (NIV) outbreaks involves coordinated efforts across public health systems, healthcare facilities, and local communities. Strategies focus on breaking the chain of transmission, protecting individuals from exposure, and managing cases effectively. Key measures to control and prevent Nipah virus outbreaks. 1. Surveillance and early detection. Strengthening disease surveillance in at-risk areas to detect cases early. Monitoring animal populations, particularly fruit bats and pigs, for signs of infection. Public health agencies often rely on laboratory confirmation, RT-PCR, ELISA, for early diagnosis. 2. Human-to-human transmission control. Isolation of patients. Infected individuals are isolated to prevent spread in healthcare settings and communities. Personal protective equipment, PPE. Healthcare workers and caregivers must use gloves, masks, and protective clothing while treating patients. Infection control protocols, ensuring strict hand hygiene, disinfection, and waste management practices in hospitals. 3. Reducing animal-to-human transmission. Avoiding direct contact with bats, pigs, and other animals in endemic areas. Preventing bats from accessing food sources like date palm sap by using barriers, e.g., bamboo skirts. Culling infected livestock during outbreaks in agricultural settings. 4. Public awareness and education. Educating communities about the risks of consuming raw or contaminated food, especially date palm sap. Promoting behavior changes to reduce direct contact with animals and improve hygiene practices. 5. Travel and trade restrictions. Temporary restrictions on the movement of livestock and people in outbreak zones to contain the virus. 6. Healthcare system strengthening. Training healthcare workers to recognize and manage Nipah cases. Ensuring availability of critical care resources, as severe cases often require intensive support like ventilators. 7. Research and vaccine development. Developing diagnostics, antiviral drugs, and vaccines for Nipah virus. Clinical trials for Nipah vaccines, such as ChAdOx1 NIV, are underway, but no vaccine is yet licensed. 8. Global collaboration. Collaboration with organizations like the WHO and FAO to improve outbreak response and resource sharing. Coordinating efforts to address zoonotic diseases through the One Health approach, which integrates human, animal, and environmental health. Challenges in prevention. Limited medical resources in many endemic regions. Difficulty in identifying outbreaks early due to nonspecific initial symptoms. Risk factors like deforestation and urbanization increasing human-bat interactions. Preventive measures and timely interventions are crucial to minimizing the impact of Nipah virus outbreaks. Continuous research and investment in public health infrastructure are needed to address this ongoing threat. Currently, there is no specific antiviral treatment or licensed vaccine for Nipah virus, NIV. Management focuses on supportive care and experimental therapies under clinical trial settings. Here's a breakdown of treatment and management guidelines. 1. Supportive care. Primary approach supportive care is the cornerstone of managing Nipah virus infection. This includes maintaining hydration and electrolyte balance, providing oxygen therapy and ventilatory support for severe respiratory distress, managing seizures and neurological complications with appropriate medications. Intensive care may be required for patients with severe encephalitis or acute respiratory distress syndrome, ARDS. 2. Antiviral therapies, experimental. Ribavirin, an antiviral drug that has been used in some cases during past outbreaks. Studies show mixed results, with no conclusive evidence of significant benefits against Nipah virus. Monoclonal antibodies. Experimental monoclonal antibodies, such as M102.4, have shown promise in animal studies. These therapies are not yet widely available but are being tested in clinical trials. 3. Vaccine development. Vaccines are under development, but none are currently approved for public use. ChAdOx1-Neve, a vaccine candidate based on the chimpanzee adenovirus platform, has shown progress in preclinical trials. 4. Infection control and prevention in healthcare settings. Isolation. Patients with suspected or confirmed Nipah virus infection should be isolated to prevent transmission. Personal protective equipment, PPE. Healthcare workers should use appropriate PPE, including gloves, masks, and gowns. 5. Research and experimental approaches. Ongoing research focuses on understanding the virus's pathogenesis and testing potential treatments, including small molecules, immunotherapies, and combination therapies. Limited access to experimental drugs in endemic areas. High fatality rates and rapid progression of symptoms make treatment difficult. While supportive care remains the mainstay of treatment, advancements in antiviral drugs and vaccines are progressing. Effective management requires early diagnosis, isolation, and supportive care combined with strong public health measures to contain outbreaks. For up-to-date information or guidelines in specific regions, refer to health agencies like the World Health Organization, WHO, or Centers for Disease Control and Prevention, CDC. In this video, we covered several key points about the Nipah virus, including its origins, transmission methods, symptoms, and prevention strategies. We also highlighted recent outbreaks and emphasized the importance of public health measures in controlling the virus. We encourage you to share your experiences and thoughts regarding Nipah virus in the comments section below. Your insights could help raise awareness and foster community engagement. If you found this video informative, please like, share, and subscribe for more content on important health topics. Thank you for watching.